general, the OCP cardiac disease risk factor is relatively low now because the levels of estradiol and progestin that are in them are very low. So they used to be really, really high, and these risks were a lot higher. Now, physiologists have done a lot of research looking at these doses and trying to drop them all where they're at a much better level. So that's a factor now. HRT, or hormone replacement therapy, as we learned about yesterday as well, it's not recommended for a lot of women. It used to be recommended a lot. Oh, you're in menopause, let's pump you with estrogen. Now it's sort of a case-by-case basis. What are your estradiol levels? Do you have none? Is it very, very low? Do you have a risk in your family for some of these different things? So in those cases, they would put you on either none or a very low dose, just a low dose estradiol, either a patch or even OCPs, because they have low estradiol levels in them. So just a low dose estradiol progesterone. Estradiol has protective effects on the heart. We don't even really understand how or why, but somehow it has sort of a protective effect on the heart and preventing some of these cardiovascular disease problems and blood vessel problems. Now notice at low levels, not really high levels of estrogen, but low sort of normal basal levels of estrogen. Other contributing factors to heart disease, high triglyceride levels. So remember we measured those in the lab. We looked at LDL, HDL, triglyceride levels. High triglycerides are associated high alcohol use, so people that consume a lot of alcohol and other drugs, and high stress. Those factors are all linked in with cardiovascular disease risk. Smoking. Why exactly does smoking, is it linked with atherosclerosis, blood clots, heart problems, blood vessel problems, not just lung cancer, which is the huge cancer risk, but all these other cardiovascular disease risks? Why exactly is that? Nicotine and CO, do you know what CO is? We learned about atoms and elements at the beginning. What is CO? Carbon monoxide, right? Carbon monoxide is produced by smoking, right? It enters the bloodstream. These end up decreasing oxygen levels that your blood is carrying, so there are depressed levels of O2 actually making it to the vessels, the tissues, the body, the organ systems, and it damages blood vessel walls. So smoking and the components, the chemical components in smoke, lower O2 levels, and they actually cause damage to blood vessel walls. That means nicks, little gashes, little lacerations. And if they have lacerations, guess what happens? Guess what your physiology tries to do when you have inside your blood vessel, you have little nicks, plaques. It goes, oh, we have a problem. Send the platelets, send the cholesterol, send the fat, send the white blood cells, and then connective tissue packs in there. It's a fatty, hardened, occluding plaque area. And that will grow bigger and bigger and bigger. And if it dislodges, it's called an embolism. That could wind up in your heart, coronary vessels, your heart, your lungs, your capillaries inside your lungs, veins inside your legs. That would be called a deep vein thrombosis or embolism. If it winds up in the capillaries of your lungs, a lot of these things are vital, right? They could really result in fatalities. So that's how it happens. There's a lot of research looking exactly on this. So when you hear, don't smoke, don't smoke, that's why. This is why. It's directly associated with causing those nicks and damage to blood vessels. So a thrombus is an occluded or a clot that's in one area. When it breaks free, if it does, and the blood pushes it out of its location, it's called an embolism or an embolus. That's dangerous because it'll float in your circulation and wind up somewhere it's not supposed to wind up. Yes, Lex?
I'm wondering if this has the same effect, because I know smoking in general just isn't good.
Yeah.
Is this also applied to smoking marijuana? Like, what if you're like a
You
chronic
guys
smoker?
always ask about the marijuana questions.
Just
No,
because I've heard that it's used for like treatment for sick
Right.
people.
it's not. There's, as far as we know, as far as I know, there's no association with atherosclerosis and blood clots and nicking blood vessels with marijuana. So smoke in that context, you're not getting nicotine. Well, that's not, I guess there's dabs, dibs, whatever the hell, what are those things? They're like tobacco, pot, all that. Woo, no. That's a bad combination. So if you're talking about that, yeah, no, this can happen. But if you're just talking about straight up marijuana, like THC, to my knowledge, there's no evidence of atherosclerosis, heart disease, blood clots, any of that stuff. So it's not just smoke or a particular herb. It's specifically the components, which honestly there's over 50 different chemicals. These are two of the most devastating to the circulatory system. Okay? So that's my shorter answer. Yeah, Drew.
Similar to like devices, like nicotine devices as well.
It doesn't matter. If you're taking in nicotine and there's carbon monoxide and all these other constituents in there, it's going to have the same effect. Doesn't matter if it's vapes, in, whatever, smoke form or non, it doesn't matter. So also this causes blood clots. I will say thrombus can build up and cause this clot, platelets, everything packing together. If it dislodges, it's called an embolism. That can be really dangerous. Usually clinical intervention, surgery, going in and removing is necessary, especially if it's in like the lungs. It also decreases LDL levels, and I don't know exactly why, but smoking decreases.
You can't find any research on that, like why?
It's really limited, but it is. There are some studies that have looked at this. They've actually looked at exercise, smoking, and various lifestyle factors and how they impact LDL and HDL. I'll send you one of the sources. But LDL levels decrease. So you should not take OCPs if you're a smoker and or if you have high blood pressure, hypertension. That's a huge heart disease and blood clot risk. Okay, so that if you're in that risk category, you shouldn't be taking OCPs. You should be using a different form of contraceptive. Blood pressure, we've talked about this, right? Blood pressure is a risk factor. You guys all know what's normal. 120/80. What's hypertensive? Higher than that. So normal 120/80, about 140 to 159, over 80 to 89, that's stage 1 hypertension. That's where they go, okay, lifestyle interventions and probably meds. But let's see if we could just do exercise and eating better to make a difference. But usually meds are already prescribed because you're not pre-hypertensive anymore. Pre is between those. You're already hypertensive. 160, greater than 160, greater than 100, that's stage 2 hypertension. Lifestyle changes and meds are used for both of those, okay? And you guys know using the sphygmomanometer, how with the brachial artery, you can assess this and figure out blood pressure real easy. So risk factors are genetic, stress, a whole bunch of other things. So you can have familial predisposition, a lot of stress, a lot of a diet that has a lot of salt and bad processed foods in it in combination with stress can also help to aggravate and create hypertension. Cholesterol, what's normal? These are all review.
80 over 20?
Total cholesterol, what's normal or good?
Like below 80.
Total, you think way back.
I don't know, 130.
Total overall cholesterol should be less than 200 milligrams. You did this test. 200 milligrams per deciliter. And actually twice. I think we did this twice. LDL should be less than 100. Low density lipoprotein. Notice they go from the chylomicron in the liver, this fat, big fat ball, to the VLDL. I didn't teach you guys about all these, but there's a bunch. Very low density lipoprotein, intermediate density lipoprotein, low density lipoprotein, high density lipoprotein. That's considered the good. That's considered the bad. This one's kind of not carrying a ton of fat and cholesterol all over the place. This one is, and it's kind of transporting it, and it's freely available. If you have a lot of that, that's not good. LDL less than 100 is ideal. HDL greater than 60, because this is the good one that helps to get the excess cholesterol and fat and not deposit it, but it's like the street sweeper sort of, and it's mostly protein. It doesn't have as much fat that it's carrying. Triglycerides, less than 150 milligrams per deciliter. These are normal, good, ideal values. Physical activity, this is another area. And you'll notice, some of these, there's research is hard to find in a lot of these different areas for looking at these things. There's a ton of research going on, but consistency and how they did the studies and what they found is you have to dig it from a lot of different researchers that are exercise physiologists, that are biochemists, that are nutritionists, that are kinesiologists. They're all over the place, and biologists. So physical activity studies have found inactive sedentary females have twice the risk for heart disease than active, physically active females. Okay? What exactly does exercise do to the body? So what I try to do is summarize some of the key things that we know research has supported that exercise or physical activity does. Lowers LDL and triglycerides, increases HDL. So those are three of the major components. Increases heart health, makes the heart healthier, has a greater stroke volume, has greater contractility. It pumps out more blood per beat than a non-active or non-healthy heart. Increases immunity, less sicknesses. People that work out and are physically active have less sicknesses overall per year than people who do not. Increases physical and mental wellness. Lots of studies on this. Increasing the physical health of your body, your muscles, your bones, including your mental wellness, bless you, and well-being, like the brain and the mind and all of those. Increases endorphins and enkephalins, all those feel-good neurotransmitters. Even things like dopamine are experiencing when you are physically active. And When I say physically active, you don't have to be out kickboxing or doing jujitsu, right? You can even be brisk walking. For me, I bust a sweat when I'm vacuuming and sweeping and stuff before. I mean, I just like sweep up. That's like a cardiovascular activity that actually burns calories, and you can feel it in your heart. Your heart rate goes up. Increases blood circulation. Increases blood circulation, so it breaks up fatty plaques. Exercise and getting the heart rate up to near maximal levels actually causes more surging of blood through the vessels and helps to clear any presumptive plaques or early plaques that are starting. So directly clearing that away and dropping that atherosclerosis risk and blood clot risk. Lowers body fat, helps in weight regulation, body weight regulation, decreases muscular tension, so the neck and the back. Many females tend to carry a lot of tension. I have a stiff neck right now. In the upper back and the neck and the shoulders. And physical activity of all kinds of different types helps to loosen and remove that tension. Just using those muscles and doing those activities helps to reduce that. Also counteracts anxiety and depression. So a lot of different things looking at exactly at what it does. And it decreases stress. Believe it or not, physical activity actually lowers stress and the stress response. Keeps you more at sort of a baseline level. So it helps to eliminate anxiety and stress. Stroke is sort of grouped in with heart disease. It's different, but it's related to the vascular system, the blood vessels. It's a clogged or a ruptured artery to the brain. Okay? Hemorrhagic versus ischemic. This means lack of oxygen getting there because it's clogged up. This means it busted, it ruptured, and it leaked blood in that area of the brain, and now that tissue of the brain is not getting the blood and oxygen it needs. Blood leaked out all over that area. So it's ruptured versus blocked. This goes over a little cartoon, whether it ruptured and exploded or whether it's occluded and blocked up. It's more common in men, but I will say more women die of stroke. And actually there's more disability in women that result from it. It's the fourth leading cause of death in women. So number 4, it's pretty high. Leading cause of adult disability. Okay? Women have more disability and difficulty returning to their daily activities. There's a lot of sneezing in here. Returning to their daily activities. But remember about language. What about language when it comes to females and males and strokes? Right. Often, and for females often, even with language, they use much more of bilateral, the left and the right for language. So most females recover better with language than males after a stroke because of the wiring and the communication and language part of the brain. So recover language better. Prevalence is higher in African Americans, and we heard about that yesterday in the presentation. 1/2, and this is some stats that go along with that, 1/2 of African American women die from stroke or heart disease. That means aging black women, half of them will die from either stroke or cardiovascular disease. It's a huge, huge risk factor. So it's a high risk. Also things that go along with this are high blood pressure, obesity, other risk factors, and a lot of the other socio and economic and cultural factors that you guys did such a good job talking about yesterday. This is all sort of linked into that. And this is showing heart disease and the prevalence in African American women, African American men, white males, white females, Hispanic Latino females versus males. So the percentage or proportion of those different populations. Stroke risk factors, increasing age, especially over 60, 65. Bless you. There's something floating in the air. Everybody's sneezing. She was actually a really famous, one of the first female actresses in the Star Trek series from a long time ago, right? She's Nichelle Nichols. She had a stroke, and she recovered after it. She's had some issues afterwards, but race, African American, this is a risk factor, African American, Latina is much higher. So higher risk factors for stroke and these vascular, it's called a cerebrovascular accident, basically, either a rupturing or clogging of one of the brain arteries. Genetics also plays a role. High blood pressure is definitely a risk factor and goes along with that. Heart disease is also an associated risk factor. Atrial fibrillation, so it's a severe arrhythmia that causes stroke. So pooling and clotting of blood that wind up in the brain. High cholesterol, diabetes, blood sugar problems, high red blood cell count, sickle cell anemia, severe anemia. And notice also sickle cell anemia is higher in African American populations as well. So that is another risk factor that goes along with this for stroke. So blood thinners, aspirin, can actually decrease risk. Because aspirin, if you are not in a high other risk for various things from taking this medicine, it can thin the blood a little bit and reduce the risk for developing clots and things like stroke. I'm going to skip this. You can look at this. These are all the different areas of the brain that if they get affected by a stroke, these are the motor and sensory and other functions that will be inhibited or lost with different types of stroke in the brain. So warning symptoms: sudden weakness, numbness, one side of the body or face, sudden severe headache, loss of balance, dizziness, coordination, confusion, trouble speaking or understanding. Unique female sides of this, the female symptoms: pain, face or the limbs, hiccups often happen, nausea, weakness, chest pain. These are really sort of specific to female symptoms. Males don't often experience stroke the same way. Shortness of breath or dyspnea, where you can't catch your breath, and heart palpitations, where the heart kind of feels like it's skipping a beat and it's kind of beating out of your chest. Warning symptoms: this is a good way to remember, and this is because this affects so many women, right? Fast, it's face, is it drooping? Arms, can you raise both? So not just one and all floppy, but raise them both equally. Speech, is it slurred or jumbled? Time, call 911 if any of those things are there. Because really, time is of the essence. Every minute you could have hundreds of thousands of neurons that are dying in that area of the brain that's not getting the blood and oxygen. So the quicker people act, the better the intervention and the better the prognosis. Long-term effects can be paralysis, speech problems, memory problems, depression, lost libido, in terms of all kinds of different things. So again, it's one of the #1 adult disabilities over age 60 is resulting from a stroke. Osteoporosis, really this is a review, but bone mineral loss, specifically calcium phosphate, is being sort of demineralized from the bones. Porous, weak bones result, increase in fractures. 80% of osteoporosis individuals are women, higher in white women and Asian women. So this is much higher in those demographics. Greatest bone loss is right after menopause. And testosterone maintain bone health, of course. So when you lose estrogen or testosterone, it causes bone resorption. So really they help to prevent that loss throughout life during the lifespan of the individual. Also, and this is something that came up, I think, a few of these things in presentations yesterday as well. High and top female athletes, so extreme training female athletes, where they get amenorrhea, exercise-induced amenorrhea, and their loss of estrogen, they're at risk for osteopenia and osteoporosis, right? So, and also eating disorders, and you guys talked about that as well yesterday. Yes, eating disorders have a greater risk for developing this when they get older, when they're especially even younger, but also as they get older because of the lack of nutrients, enough calcium, enough vitamin D, the bones start to demineralize. Half of all women over 50 will have a bone fracture due to some type of bone loss, even if it's not osteoporosis. So half of all aging women. Typically it's in the hips, but it can be the spine, the wrist, the ribs. Hip fractures are 2 to 3 times higher in women. And remember we talked about pelvic floor prolapse. I have a slide that sort of talks about that. Higher in women, but death rates are higher in men. So females tend to break their hips more often, but they survive from it for longer. Males break their hips and it's usually the beginning of the end. So hip fracture, 25%, a quarter of patients that have a hip fracture after the age of like 50, 60, they will die within 1 year.
Very accurate. Very accurate.
And this is a true thing, and people don't really talk about this, you don't realize it's the beginning of the end. And it relates to osteoporosis, bone fractures, mortality. It usually is the beginning of the end. So, this you can get a DXA done. Basically, it's a bone mineral density test, dual energy x-rays. They put you in this thing to analyze usually the hips, the spine, where you can see the density of the mineral, the bones in those areas. Now we have drugs, calcitonin, you learned about that in the endocrine system, estrogen, analogs, bone building drugs to help reverse it. Notice though the best treatment is prevention. Throughout your entire life of the calcium stores that are in your bones and maintaining your bones through nutrition, exercise, and health so they don't actually fall apart. So all those things are really key. Pelvic floor prolapse, I talked about this in our lab, and we talked about with menopause and reproductive aging. But I just put this together so you can see visually what it looks like. The pelvic floor muscles, here's normal. If those muscles get weakened or destroyed or damaged from multiple childbirths or other different problems, the inner part of the vagina, the rectum, the bladder, the urethra can start to protrude out of the body. And they can come all the way out. This affects 1 out of 3 women, so over age 65, 1 in 3 women will have some variant of pelvic floor prolapse. Incontinence or inability to hold your bladder and not pee often develops. And remember we talked about adult diapers, leakage products, those outsell baby diapers. And this is a big component of that. But people don't talk about that. Oh yeah, I pee my pants, so I have to buy diapers and all these little products. It's not a really advertised thing, but it's part of this process. Incontinence is linked with hip fractures. So this is all linked to bone health, right, pelvic floor prolapse, incontinence, and other factors. Again, I'm going to link in exercise is key, Kegels. And for those of you that have never done them and thought I was crazy that I even said that, it is actually exercise and contracting the PC or the pelvic floor muscles. So it's like you can do it while you're urinating. You could stop the flow of pee, start the flow of pee, stop. You can even sit there and clench, like you're trying to clench a walnut between your butt cheeks or something. I know that's weird. I'm sorry. You'd have to delete that part. But it's just that contracting. That's it. And actually, I will even say it doesn't just help prevent things like this, prolapse, but it actually improves sexual function, orgasm, sexual health, all kinds of stuff. So you should be doing your Kegels. I know it sounds crazy, but you should be doing your Kegels. All right, there's a question. Yeah, some up.
Is osteoporosis or patients die after hip fractures because they become sedentary?
Sedentary, yes, and just a lot of other complications. They have to be in the hospital for a long period of time. They're immobile. They end up getting infections and sickness. Believe it or not, sometimes in hospitals, that's where people get infections and they end up getting sick. So that goes along with it. Yes?
For the testing that you're talking about for osteoporosis, is that also like symptoms like based, or can you do it like preventatively?
I don't get your question. Talk to me afterwards, okay? Because I got to finish the stress part and I have like 7 minutes to do it. So we'll talk about it afterwards. Stress, this is the body's response to demands or stressors. Notice expectations and perception really, really affect. There's good versus bad stress, eustress versus de-stress. And I will say not the entire fight or flight process, it's not all bad. It's good. It allows you to compete, to think, to stay on your feet, to perform. If I didn't have a fight or flight response, I would be no good at being a teacher. I mean, maybe you don't think I'm a good teacher, but doing stuff like that, I have to have that little excitement, fight or flight response almost every single time. And it allows for performance and motivation and enthusiasm and all those different things. But if you have it too much, and it's the bad, the distress, that can tear apart the body. Types of stress, there's all different kinds. Biochemical, toxins, poor nutrition, social, psychological, anxiety, psychosocial, philosophical, lack of purpose, value systems, all these different kinds. The overall fight or flight, remember we talked about the 4 Fs. That response is good and necessary, and it can have a lot of benefits. The reason it's built there, we're not the only animals that experience the fight or flight. This is way back in our lizard brain that starts this. The hypothalamus, the autonomic nervous system. You have really not a lot of control. What you have control over is your expectations and your standards that you sort of set for yourself and that you expect. But your body's going to have this response when it feels like there's a threat. Prolonged response, though, with no breaks is really bad. We've talked about general adaptation syndrome already, alarm, stress resistance, exhaustion. This is fight or flight. This is going back to homeostasis, and this is breaking down the body now and sickness because it's been too long at this stress level. The autonomic nervous system is involved. Sympathetic nervous system is fight or flight. Or 4S, parasympathetic controls routine functions, baseline, rest, and digest. This will probably be a lot of you guys like Tuesday night or like Sunday night, like falling asleep studying. The autonomic nervous system is parasympathetic and sympathetic. It's a whole series of nerves, cranial nerves, and body nerves that go out to all these different organs that allow all these structures to respond in the right way. And they kind of have antagonistic effects. You can read over this on your own. Speeding up the heart, increasing respiration rate, decreasing gut movement and urination, all that if you're sympathetic. Parasympathetic, you don't need a fast heart, you don't need a fast respiration rate. You're digesting, you're peeing, you're doing all your routine maintenance. Okay, this is the 4Fs or the fight or flight. Stress response, this is all sort of review. These are the different things that activate stimuli, the brain, thalamus, cortex, hypothalamus. It activates the endocrine system and the autonomic nervous system. So those 2 different components. This summarizes all those things we were talking about with cortisol, metabolic rate increases blood glucose and metabolic rate. Aldosterone increases salt and water retention, so ultimately a high blood pressure. Activation of the autonomic nervous system, same thing, epinephrine, norepinephrine, causes blood glucose to go up, vessels, increased heart rate, all that stuff. And this was a diagram I showed a long time ago, just to come back to again. Short-term response to stress, adrenal medulla. Long-term response, the brain activating the adrenal cortex with aldosterone and cortisol. So those start to come into the system and they pump out for days, weeks, months. Do females respond to stress differently than males?
Yeah.
Absolutely. And you all know this firsthand, I'm sure, right? Especially right now. Men respond more aggressively against the stressor. So anger, arguing, avoiding, alcoholism, those are higher in men. Women tend to respond to stress by seeking support of other women. This shouldn't be surprising to you. They tend to want to talk about it, right? Or vent, right? Or aggregate together and redirect energy to talking, caring for their homes, caring for their children. This was proposed by these two stress researchers at UCLA as the tend and befriend response. I'm not totally, fight or flight is still there, but there is definitely a female response that's different than males. Oxytocin is released in women, stronger than it is in men. So this buffers the fight or flight response. It calms it, if you will, encourages gathering and talking. That releases more oxytocin when you're talking and hugging and getting all over each other like that. More oxytocin, calming effect. It actually buffers or blunts the stress response. Human primal survival, effective strategy for protecting other women, for protecting children, offspring, all that stuff. All right, so what are the diseases? Tension, migraine, headaches, migraines. You get migraines? Yes. I hear you. Muscle pain and tension, insomnia, lack of sleep, anxiety, amenorrhea. Chronic stress now is linked with depression, GI tract disorders, high blood pressure, cardiovascular disease risk, diabetes, weight gain, sometimes weight loss, that goes both ways, various different cancers, immune dysfunction, suppression of white blood cells, causes inability to fight off different types of infections. So, usually sickness follows long bouts of stress, and you are all very familiar with this. Depression is higher in women. PTSD is higher in women. Here's a couple. This is a few years old, so now it's updated a little more, but the numbers are about the same. Specific phobias, 13.9% women, 6.7% men. PTSD, almost all of these are doubled. They're twice the rate in males. Looking at females and all these different agoraphobia, not wanting to go outside or be real social, panic, obsessive compulsive disorder. So many women, cisgender, LGBTQ women have experienced sexual harassment or threat, assault, or rape at some point, and a lot of this heightens the stress response. That's maintained and kept in the brain and can result in some of these anxiety and mood disorders, as well as a heightened stress response. So, yeah, we experience and report higher levels of stress in females. Women live longer, so they can cope with that stress better than males, in general, physiologically speaking. Now, if you guys will just bear with me for a couple minutes, because I'm going to go over, because I think this is important. I want to talk real quick about how to get rid of stress and handle this part, and I feel like it's very important. Major life events can result in stress. Losing someone, losing a job, breaking up, dealing with life, everything life throws at you. College stress, specifically affecting you all, especially a lot of female college students, report way more stress than male college students. And if you look into the stats and the reasons for why, it's not just that women like to stress themselves out and are stressed all the time. They take on a lot. Females on college campuses tend to organize and mobilize and create things and start clubs and join extracurriculars and lead protests and interact with their professors and organize. That is much higher in the female population. So no wonder females experience way more stress than males. They're doing more, they're juggling more. And I'm not being stereotypical, I'm saying this is the facts. This is what we find even among faculty. The same thing holds up for female faculty. I'm split in 80 different ways at any given time, and I know you guys can relate to that same thing. Daily life hassles, some people find these very, very stressful. Financial stress, and you guys talked about in your presentation, that can be huge. Technology and stress, cell phones. I know you all, if you put your phone down or you're away from your thing, I'm sure it probably causes stress initially or discomfort, right? Everybody is connected to that, and it actually promotes a little bit more stress. Women in the workforce, especially professional and moms, have really high stress. Multiple roles that women are expected to play, that takes a toll and causes more stress in women. Type E woman is the everything to everybody. Don't be that woman, okay? Don't be that. It is common in the 20s. That's all, most of you all right here. Don't be the E woman. That's no necessary for that. Stress impacts from race and age. So a lot of the things you guys talked about in your presentation, that causes stress on that individual woman, on that female throughout her life. Workforce stressors, Workforce stressors on women and work-life balance. We're all hearing about this work-life balance, and really it's life balance. Because whatever you do in your life, hopefully you love it and you're passionate about it. It's part of your life. It's part of who you are. It's having a life that's balanced and healthy and not filled with stress. So keeping healthy mind, body, spirit. Reducing stress. This is really important. So important, and I didn't really truly realize it for a while. Girlfriends, friends, support system, sisters, family, whoever. That social support system is huge for stress reduction. Check your circle. Don't be with people that are not making you a better person, that are putting demands on you, that are not making you live out your full potential. Axe them, get rid of them. Another way I like to say is trim the fat, declutter your life. Trim the excess fat and get rid of it. Do I really need to do this? No, I don't. I can say no to those different things. And this is on video too, so you guys can watch it. Learn to say no. And this is a situation of healing the people pleasing. You don't have to please people. You're never going to please every single person every single time. So it's okay to say no. And I'll give you another little tidbit. When you tell people no, you don't tell them no and then give them an excuse. You don't give an excuse. It's none of their business. Even if you love them to death, it's none of their business. No, I can't. I'm so sorry, I can't. You give them a no and an excuse, guess what they often follow it up with? Oh, that's okay. Bring the kids. Or, oh, it's okay. You could just bring your friend. It turns into like digging more into your personal boundaries in your space and crossing that line. So I've learned that. I just learned that in this last 5 years. It's helped me tremendously. Just say no and feel okay with that. Stand in that space and stick to those boundaries. If you set precedents, people will always walk over those precedents. They'll go, oh, she did it before. She emailed me at 2 o'clock in the morning before. She'll do it again. So if you set it up, it's going to happen. And people are good, but they will take advantage. People will always they're self-seeking as well. They're trying to get, especially if you're good and you're multi-talented. Say you're good at a lot of different things, you're going to be pulled in a lot of different ways. People always love somebody that's good at what they do, right? I'll go, can you do this? Can you be involved in this? Can you help with this? Can you speak at this? And if you do all those things, you're going to kill yourself with stress, right? It's not going to be good for your physical and mental health. Perspective taking. There is trauma history often, so you have to sort of not catastrophize and go back to that and try to focus on the positive and take in a realistic perspective. Just try to take in everything for what it is. Don't over-exaggerate things. Set reasonable goals and expectations on yourself. You are what you think. If you think you suck, you're going to suck. If you think you're not good, you're not going to be good. If you think you're not worthy, you're going to end up being not worthy and feeling that whole self-fulfilling prophecy is a real thing. So nurture physical and mental health, exercise, yoga, massage, meditation, therapy. And I didn't add this here, but this is super, super important. So many research studies now are pointing to, we didn't even really know why we needed sleep, but now we know sleep is related to so many different anxiety and mood disorders and addiction problems, and even linked with neurodegenerative diseases like Alzheimer's, not getting enough sleep. A lot of research. I could do a whole class on that, but we didn't have time.